Hello viewers, this is the Innovates bringing you the pharmacology series. My name is Joseph Luswabi and let's start off with the introduction to pharmacology.
And to share with you the definitions and how to name the drugs, or the naming of the drugs, how it's done. The first one is pharmacology. Since we are doing pharmacology, we need to now understand all the definitions that are involved. The first one is pharmacology. For the definitions, if you look at all these red, there is these green boxes, there is a summary or key points that I've tried to put, and it's from that I always based on to explain the rest. So in pharmacology, you need to know the first three core components. One is when you're talking of pharmacology, you need to know you're going to be talking about properties of a drug, you're going to look at the interactions, and you're going to look at the effects on the living system. So pharmacology can then be defined from these three core components. It's a science that deals with properties of drugs, which are here, their interactions with and effect on the living system. So science that deals with the properties of drugs, their interaction with and the effect on the living system, that is pharmacology. We shall go to the next, which is a drug. So a drug, here you're going to know that it is actually either a chemical or a substance, and this chemical or substance is going to be used in modifying. What is it modifying? The physiological processes or pathological state. And when it is modified, it is actually to the benefit of the recipient. So the definition of a drug is then a chemical or substance that is used in modifying the physiological or processes or pathological state for the benefit of the recipient. Yes, so you're looking at a chemical or substance that is going to modify the physiological processes or pathological state so that the person or the recipient can benefit. Then let's look at pharmacokinetics. So pharmacokinetics, now these are the 6 things that you need to know. One, it's a branch of pharmacology that you need to always remember, and this branch of pharmacology, for it, it's going to look at the mathematical description. This mathematical description that is actually looking at will basically be more in the changes in drug concentration, where in the body, for how long, you're looking at the time, and you're looking at also the processes that are responsible for the concentration changes. So here in brief, it's basically telling us this is pharmacokinetics, is what the body does to the drug. So when we are defining a good definition, then it would be, it refers to the branch of pharmacology that deals with the mathematical description of the changes in the drug concentration in the body with time and the processes that are responsible for these concentration changes. So a branch of pharmacology that deals with the mathematical description of changes in drug concentration in the body over time with time and the processes that are responsible for those concentration changes. That is pharmacokinetics. After pharmacokinetics, we then go to pharmacodynamics. Pharmacodynamics, we are looking at actually the branch of pharmacology still, and for it, it's going to focus more on the mechanisms of actions for this drug, and then you're looking at interactions with the receptors, enzymes, and also the relationship between the dose and response. So this is basically what the drug will do to the body, what the drug does to the body. That is pharmacodynamics. So when we are to put a solid definition, then we shall say that it's a branch of pharmacology that deals with the mechanism of action of the drug. These mechanisms of action will include their interactions with the receptors, enzymes, etc., and also the relationship between the dose and the response. Yes, at the back of your mind, remember that it's what the drug does to the body. Yes. And when we go to therapy here, it is just something that is in general, and here we are looking at treatment of the disease or disorder in general, and that is we have the pharmacotherapy, chemotherapy, and we are going to see some of these in the next. Now, I try to hint out pharmacotherapy. You're going to look at the drug use, you're looking at treating, and you're looking at disease in general. So we shall define it as the use of drugs to treat a disease in general. Here we're looking, it could be infectious or non-infectious. Chemotherapy, for it will focus what is different. It will focus on killing the causative agents. So it deals with the treatment of disease using drugs that kill the causative organisms or agents of the disease or cancer cells. Yes. Then toxicology, you're looking at 3 cores. You're looking at its study, ecology. You're looking at adverse effects, and you're looking within the body. So you want to study the adverse effects of a drug within the body. So the study of adverse effects of the drug on the body is toxicology. You're looking at the mechanisms of toxicity, detection, and things of that sort. Pharmacognosy, you're going to look at 5 cores. The first one, it's a branch of pharmacology, and this branch of pharmacology, for it's going to be focusing on basically studies of sources of drugs. These drugs, they are also either they could be also identifying new drugs from the natural sources. So pharmacognosy is the branch of pharmacology that involves the study of sources of drugs or identification of new drugs from natural sources. Clinical pharmacology is the study of how drug effects in healthy and diseased animals affect their clinical use. So here we have an example that if a drug is mainly excreted by renal processes, its dose must be reduced in animals with renal failure, because it will, if the doses are high, then it would bring a problem. Then pharmacometrics is the science of obtaining and integrating data about drugs for decision making on appropriate dose regimen, effective and safe plasma concentration. Yes. When we go to pharmacovigilance, we are focusing on pharmacovigilance. It's a branch of pharmacology. It's a pharmacological branch, and this branch will involve more of collection of information. We collect information. After collecting this information, the aim is to see or to identify, monitor, and to prevent adverse effects when we administer drug. So pharmacognosy is a pharmacological science that deals with the collection of information in order to monitor, identify, and prevent adverse effects of drugs in following their administration. Remember, you permit, once a drug is out, you want to come back. So that's why we are saying following their administration. Pharmacoepidemiology, for it's going to focus more on to the use of the use patterns and effects of a drug in a population. How, why, when, where is a drug being used? So you're looking at the use patterns and the effects of a drug within a population. Now, pharmacogenomics, something very interesting. It has 3 core key points. You're looking at the gene, you're looking at the animal species, and you're looking at the response of the drug. So some species are responsive to some drugs due to their genes which are present ideally. or would be absent. So this deals with how the genes affect animal species or individuals' response to drugs. How the genes affect animal species or individuals' response to drugs. In this picture, you're seeing this is a collie. Now, how we identify collies is they have white socks. Now, these dogs are hypersensitive to ivermectin. When you give them ivermectin, they are going to have these major signs. There is going to be hypersalivation, ataxia, blindness, coma, respiratory distresses, and stress and death. So why is this happening? It's because these collies are deficient in the MDR1 gene that encodes for the transmembrane protein, which is the P protein, that is an integral part of the BBB, which is the blood-brain barrier. So they lack this protein, and meaning that ivermectin can now reach the brain. Yes. Now the next is pharmacopoeia. So if you look at this picture, it's basically a pharmacopoeia, the Indian Pharmacopoeia 2018. So this is basically an authoritative book. This book is going to have the list and description of drugs. These drugs, it's going to try to elaborate the standards of its production, dispensing, and using. So a pharmacopoeia is basically an authoritative book containing the list and description of drugs together with their standards established for their production, dispensing, and use. So that's a pharmacopoeia. Now, a formulary for it is basically, if you look at this is the list, you're looking at the generic and you're looking at the brand names here, brand names. So it is basically a list of drugs, both generic and brand names, approved for use in a given country. So this list is going to be produced, and it's what the drugs are actually allowed to be used within that country. So it also contains the contraindications, adverse effects, storage conditions, and things of that sort. A dose refers to basically the amount of drug administered at any time. So this is normally expressed in milligrams per kg of body weight. The dosage, you're looking at a treatment plan detailing the frequency of administration of the dose and the time interval between the dose. So you're looking at for how long are you going to be giving that dose, and after how long should that dose be given. So for example, 3 milligrams per kg should be given 4 times a day at the interval of 4 hours for 5 days. So treatment plan detailing the frequency of administration of the dose and time interval between doses. The next is, in a drug, there are going to be 2 components. One is going to be the active pharmaceutical ingredient, which is the API, and the other is the excipient. Now, the active pharmaceutical ingredient is the substance or component or molecule that is responsible for the pharmacological effects of the product. So it's the real drug that is actually it's the real component that is going to bring about the results. For example, the oxytetracycline, the ivermectin. Now, the excipient, for it, it's going to be the non-pharmacological active component of that drug preparation. It's basically just giving maybe the volumes, e.g. the buffer, the stabilizers, the starch. So they are not pharmacological in any way. Now, let's look at the naming of drugs, or how the drug names come about. Now, from here, you forgive me, but these arrows were supposed to be reaching. I don't know why in the presentation it shows like this. So we have what we have phonemes. The first one is the chemical name. The chemical name is that chemical structure. For example, you have now, this is all meaning it's a dewormer, which is the same category in here. Methyl N6 propyl sulfonyl 1H benzimidazole 2 carbamate. So that is the chemical name. So rarely would you actually see this name, and you don't need to actually cram it to some in one or the other. Then the other, which is very important, is the brand name or the proprietor name or trade name, and this one is patented by and owned by the pharmaceutical company. So for example, Albenda 10%. Now this is a brand name. In most cases, farmers know brand names. Now, for you as a veterinary personnel, what we need to actually know very well, we need to know both the trade names and also we need to know the generic names. The generic names are names that are internationally recognized. They are non-proprietary names. For example, albendazole. That is more or less wherever you will go and you say albendazole, someone will actually give it to you. It could be made by different brands, different companies, which will give them different brand names, but that will never change. And then the group name is the category under which that drug lies. So usually indicates the mode of action, pharmacological effect, and the chemical group or chemical use.
Hello everyone, I'm Kato Lawrence Kanyike, and today we are going to look at the drug dosage forms. Well, the drug dosage forms are simply the physical forms through which drugs are delivered to the different sites within the body. These could be the solid dosage forms, the semi-solid dosage forms, and the liquid dosage forms. So under the solid dosage forms, we can have the tablets, the capsules, the suppositories, the powders, the pellets, and the lozenges. Then under the semi-solid forms, we can have the creams, the ointments, the liniments. And then under the liquid dosage forms, we can have injections, syrups, elixirs, tinctures, aerosol sprays, and lotions. Well, we are going to look at each of these in details in the subsequent slides. Drug dosage forms can as well be classified basing on the route of administration, whereby you can have the oral dosage forms, the parenteral dosage forms, the topical dosage forms, and the inhaled dosage forms. So in this presentation, we are going to look at basically the oral dosage forms in detail. So why do we need to know the different drug dosage forms? First and foremost, to administer the accurate doses for the different ailments. We all know that the different drugs prefer different administration routes and the different dosage forms. So it is practical to give these drugs in the different dosage forms in order to ensure that we administer the accurate doses. Secondly, we administer these drugs to protect them from the gastric secretions. For example, the enteric coated tablets are coated with substances that protect them from gastric secretions and gastric digestion. Thirdly, masking taste and odor. For example, the syrups and the sugar-coated tablets are coated with the sugar in order to mask the taste. Then sustained release of the medication, for example in lozenges, whereby the active pharmaceutical ingredient is strongly adhered to the gum, which facilitates slow and sustained release of the drug. So we begin with the first oral dosage form, which are the tablets. These are basically the hard compressed medications that occur in round, oval, or square shape. Well, these might be coated in order to hide the taste of the tablet's components. For example, the sugar-coated tablets, or to make the tablets smooth and easier to swallow. For example, the film-coated tablets. Well, we can also coat these tablets to make them more resistant to the acid environment, as we explained before. The enteric coated tablets that are resistant to the gastric juices in the stomach, but also to extend their shelf life. Well, to begin with, the sugar-coated tablets. These are compressed tablets with a sugar coating which may be colored. It's useful in covering up drugs with objectionable tastes or odors and protecting the drugs sensitive to aerial oxidation. Well, we could also have the film-coated tablets, which are coated with a film of a water-soluble material. These are the same as the sugar-coated tablets, but they have an added advantage of reduced period of required for the coating operation. So we proceed to the enteric coated tablets. As I explained before, these are tablets that are coated with substances that resist secretions of the gastric mucosa in the stomach. And these ones, as they bypass the stomach, they are disintegrated in the intestines. We could use such drugs in cases where the drugs are inactivated or they are destroyed in the stomach, and also for those drugs which irritate the mucosa, and for also delayed release of the drug. So for the boluses, these are large tablets. They are large tablets used to provide large doses of the drug in large animals. These ones are especially used in horses. We proceed to the capsules. These are medications that are given in gelatin containers. They can be hard gelatin capsules or the soft gelatin capsules. The hard gelatin capsules are those for the dry powdered ingredients, and whereas the soft gelatin capsules are those for the oils or the active ingredients that are dissolved or suspended in oil. So we can use such capsules in case we want to mask the unpleasant taste of the contents of the drug. So as I said, the hard gelatin capsules and the soft gelatin capsules. So the lozenges, which are solid preparations consisting of a sugar and gum, this gives strength and cohesiveness to the lozenge and facilitates slow and sustained release of a drug. Well, these medications are used for ailments such as cough. They are used as remedies for ailments such as cough. So we proceed to the oral powders. These are for internal use. They can be dissolved in water. They are divided into the bulk powders and the divided powders. Well, the bulk powders are multi-dose preparations, in that it's a bulk of a medication whereby you need to take a small portion of the medication and cover it. This could be used several times. But then for the divided powders, it's a single dose preparation which can only be used once and dissolved in water. For example, the ORS preparations. Then we have the oral solutions and the oral suspensions. Here the difference is that for the oral solutions, the active ingredient is dissolved within the solvent. But whereas for the oral suspensions, the active ingredient appears as a suspension in a solvent. It can also appear as a sediment, whereby you need to first shake the preparation in order to have a uniform dispersion of the active pharmaceutical ingredient within the whole solution. So as we proceed to the syrups, these are concentrated aqueous solutions of the sugar, majorly that is sucrose, and these ones contain flavors that mask the bad taste of the active pharmaceutical ingredient. In contrast to the syrups, the elixirs, in addition to the sucrose, they also contain ethanol and antimicrobial preservatives that confer stability to the preparation. These ones are also clear oral preparations that are used for drugs that may be nauseous, that cause nausea in humans and also in animals. So in this video, we've appreciated the different drug dosage forms, specifically those for the oral route.
Hello everyone, my name is Kazwa Patrick, and today I will be discussing the drug dosage forms, the topical, the parenteral, and the inhaled. When we speak of the topical dosage forms, these are simply any medications that are applied to the body surface, and this can be either the skin or mucous membranes. An example is the ointments, creams, liniments, lotions, pour-ons, topical powders or dust, and tinctures. So we are going to delve more into each of these and understand them better. So the ointments, they are the semi-solid drug preparations with a greasy or oily texture. So these drugs are lipophilic and they are composed of a base and an active ingredient. A base is like a vehicle, and its role is to carry and deliver the drug to the skin, and as well it is the one that is responsible for the consistency. By the consistency, I mean this greasy appearance and the semi-solid nature. Then the active ingredient is the drug. So, for instance, the way you see this antibiotic ointment, meaning that this preparation, it has a base which is responsible for the semi-solid appearance, but the active ingredient in it, they are the antibiotics. For instance, the neomycin and the polyphrine and the bisulfates, as it is in this triple antibiotic. These ointments can be used as emollient. Emollient is something that has the ability to soothe or to soften. When we talk of the creams, these are semi-solid preparations and they contain mixtures of oil and water. So they can have a water or oil base, and this will give us two types of creams. A is the oil in water creams, that is the O/W. So these ones, they have small droplets of oil that are dispersed in aqueous phase. So they are less greasy and they are more easily washed off because they will not stick so much onto the skin, as you can see in this picture. So this is how they will be. You will have more of these oil water droplets and a few of the oil droplets. Then part B, sorry, this one was supposed to be part B. They are the water in oil creams. So these ones, they have small droplets of water that are dispersed in oily phase, as it is visible in the picture. The lotions are simply liquid preparations, and for them they are directly applied on the skin or on a suitable dressing to reduce evaporations. Their role is to moisturize. They have that soothing ability as well. So in the left picture, I was just showing the difference between the lotions, creams, and water in terms of the amount of water contained. So the lotions have more water, followed by the creams, then the ointments have the least amount of water. The liniments, which are also referred to as embrocation or heat rubs, they are liquid, semi-liquid, or semi-solid preparations, and they create a warming sensation on the skin. As usually, they are applied along with massaging in the affected area, and they contain a counter irritant which prevents or which can overcome the irritations for the muscles or the tendon injuries. And caution should be taken for them not to be applied to a broken skin. An example is this absorbine veterinary liniment, which can be used in the horse injuries. Yes. The poirons, which are also referred to as backliners, they are liquid preparations, and these, they are absorbed systemically after being poured onto the animal's backline. For instance, this picture here, it is showing how these backliners will work. So you pour it along the vertebra, simply on the backline, and this drug will be absorbed because they are lipophilic. They can easily be absorbed through the skin, and they will enter the circulation and they will function there. And they are mainly used in the control of internal and external parasites, and as well certain infections. And the best example is this flumethrin poiron. The topical powders or dusts, so these ones are simply solid, and they are dusts, and they are applied against ectoparasites. Best example is the Sevin dust, which is used in the dogs. So it is applied in the fur or the hairs of the dog, and it will kill the ticks, the fleas. Yes. And then we have the tinctures. So these ones are drugs that are dissolved in water and ethanol. So the ethanol is to dissolve the hydrophobic substances, those which may not dissolve in water, and as well to provide preservative properties. The best example is the iodine tincture, which is usually applied on the open wound because it has some antiseptic properties. Now we shall look at as well the other form, which are the parenteral dosage forms. So these are drugs that are administered through other routes other than the alimentary canal or respiratory tract. Yes. So these are simply injections or infusions. So the injections can be intramuscular, intradermal, or subcutaneous. Then infusions, they are the IV infusions. So these drugs, they are prepared as a liquid for introduction into the body using a hollow needle and a syringe as the applicators. So these drugs can be solutions for injections, suspension for injections, and the caution should be taken that for the IV, the intravenous application of the drug must be a solution, not a suspension. Anything that is to go into the blood must be a solution, not a suspension, because if it is a suspension, it will cause friction within the blood, and this will bring about hemorrhage to rupture the the red blood cells. And when this occurs, the clotting can easily be initiated, and somebody will develop, or the animal will develop a thrombus, and it will bring about disastrous effects. Then we have other forms such as injectable powders. So as they are powders, they will be first dissolved in water, and then they can be administered IM. For instance, the antitrypanosomals, just as this tripashish, yes. Then we can have intramammary infusions. These are administered into the teats to treat mastitis in those non-lactating and lactating animals. Then another form of parenteral dosage forms is or are implants. So these are compressed tablets whereby the drug is dispersed in a non-degradable polymer, and this polymer is put under the skin. Just as you can see in the picture, the drug is placed in this capsule, which is composed of a non-degradable substance. So the drug is there, and the drug will be released in bits slowly, not at a go. The drug will be placed there and it is released at a slower pace, and usually this is the applicator. As you can see in the picture, the drug is put under the skin, and these drugs, they are those that are used to increase the weight gain, those that are used to decrease the feed conversion ratio in the food animals, and then those that can increase the reproductive performance. They are drugs which are usually applied in such manner. And then lastly is the inhaled dosage forms, and here we have the inhalers and then the nebulizers. So for the case of the inhalers, they are solutions or suspensions of drugs which are held under pressure in an aerosol dispenser, like an air chamber. And this air chamber, when it is initiated to release, it will release very small droplets, and the patient inhales through a mouthpiece. And this is evident in the case of those patients with asthma and then the related respiratory problems. Just as you see this asthma equipment, it has a mouthpiece and then the canister which is containing the drugs. Then the nebulizer. So with the nebulizer, the drugs are administered in a form of a liquid mist to the airway. So there's a nebulizer machine. So this machine is used to pump the air or oxygen through liquid medicine, and then this medicine can be turned into a vapor, and this vapor can be inhaled by the patient. So this one also can be seen in those drugs that are used as a CNS suppressant, the sedative drugs, anesthetic drugs. Thank you very much for listening.
Hello everyone, this is Kasada Owen, and today I'm here to take you through the routes of administration of drugs. Yeah, I'll start with an introduction. So the routes of administration of drugs means the routes or methods that determine the delivery of drugs in the body. And basically they include the oral routes, the parenteral, intraperitoneal, and inhalation and topical, as we are going to be seeing each and its advantages and disadvantages. So we begin with the oral route. This is where the drug is given via the digestive tract for either local or systematic effect, that is the non-localized effects. So what are some of the advantages of this oral route? Now, first and foremost, it is cheap and safe because there is no need of sterilization of the site, and also you don't need any skills because the patient can take the drug by themselves, and there are no special devices that are required because you can use cheap devices also, for example, bottles. You can use even the food the animal is going to eat, where you just ingest the food and take in even these tablets. We have also the other advantage that there are a variety of dosage forms that can be given via the oral route. For example, there are tablets, capsules, the oral powders, oral suspensions, and many other ones that can be given via this oral route. Then the other importance is that it is economical because of the cheap doses that are needed. Because you know that, for example, if maybe you have headache, you'll only need a paracetamol of just like 500 shillings to heal your headache, or even 100. So it is so economical. There is even the local effect that can be achieved. For example, when we are fighting against these GIT worms, we can use mebendazole and metronidazole, where they will act specifically on that target, targeting the worms within the stomach. Then the disadvantages of the oral route is number one, is that sometimes it is inefficient in that if the drugs can have are poorly soluble, they will suffer poor availability, meaning they will not be given in the form that is available to be used. For example, gluciferin, and also we have protein drugs like insulin, which are easily destroyed within the stomach, so they will not be easily available in places where they are needed. Then the first pass effect, which refers to the hepatic metabolism of a drug when it is absorbed in the gut. So, and it is delivered to the liver via the portal circulation, in that when a drug comes, it is absorbed in the stomach and then taken via the portal system, the hepatic portal vein, taken to the liver where it is metabolized. So it will not be able to do its role because it is detoxified. In short, it undergoes biotransformations or metabolism. Then it is very slow for emergencies, in that if the animal maybe it needs an emergent treatment, we can't use tablets because it can't take in the drugs. It is very hard for it to be biotransformed or to make it available for to be used in the target organs. Then also food can be an effect in the absorption of these drugs. In that if the individual realizes there are some drugs whereby they tell you to take them, but you can't take them in and again eat. An example I can give there, the tetracyclines that are taken in with milk. Yeah, so these tetracyclines, if you don't take them with milk, then it means they will be affected in their absorption. Then we have increased adverse effects, in that some antibiotics or drugs that are given may kill the normal gut flora that is formed, and even some can convert. These can lead to the growth of some fungal groups within the GIT, and in so doing, they will be causing what? Infections, more further infections. Some oral drugs, the tablets, can cause irritation to the gut wall, specifically those ones that are kind of acidic or have ingredients that are kind of acidic to the gut wall. We have that it cannot be used in unconscious patients, as you see the tablets, capsules. You can't give them orally to the you can't use the oral route when the individual is unconscious because they will be unable to swallow. The parenteral route, this is basically where we use a drug is being injected using a hollow needle into the body at various sites and also in varying depths. Yes. So we have basically three subdivisions under this route. We have the intravenous route, the subcutaneous route, and the intramuscular, as you're going to see each under here. The intravenous route is where basically this is being used when we are administering liquids, and we are administering this liquid directly into blood via a vein. So it can be divided into two. We have the intravenous bolus and the intravenous infusion. The bolus is where we are administering a drug through a route over a negligible period of time, of a short period of time. For example, if maybe they are just injecting an individual, let me say, I'll give an example in the human medicine. You're sick of malaria and they're injecting you on the butt. That means that is an IV bolus. Then we have this one, or you're just injecting in a vein on the arm. Then we have intravenous infusion, where the drug is being administered at a constant rate over a long period of time. This is in most cases occurs when they are using cannulas, whereby you're injecting the drug slowly at a slow rate, but delivering it at a slow rate, but over a long period of time. Yes. So this is basically being used if we need slow release of the drug. Then advantages of the intravenous is that it is precise and accurate, and that is because it has 100% bioavailability. As I told you, bioavailability is where the drug is being made available in its active form to be utilized for the target organs. Then it is good for emergencies due to its rapid onset. Immediately they use it, it can easily act. Then it can be used even in unconscious patients. Even if they have fainted, you can still do it. With the fast pass effect is avoided because the drugs are going directly into blood. They are not passing via the GIT. Then we have large quantities can be given. This is specifically during the infusion, the IV infusion, where we are giving at slow constant rates, but we can give a higher dose. Disadvantages of the intravenous is that there is high risk of side effects. For example, embolism means that some drugs, if given, and I can give an example of ivermectin, if given and not, we don't rub that place or massage it, it can lead to clotting of blood within that area, and that is a side effect that is serious, what we call embolism. Then also some drugs, this route is less safe in that high concentrations attained, they can be easily attained, and this can lead to adverse effects. If you give unknowingly, if they say that you have to give 0.5 mils of ivermectin and then you give 1 mil, that can cause adverse effects to the body like great itching, dog fainting, or the animal, and many others. There is increased risk of infection if the area is not sterilized or even the equipment that are being used. Then that is specifically the needle. Then the drug can't be easily removed after injection. Yes, then it is expensive due to the machine equipments that are needed, and also it requires some technical expertise. If you don't know how to inject, it will be hard to use this route. Then the subcutaneous route is that route where we are administering into the subcutaneous, that is the layer of the skin between directly below the dermis and the epidermis. So basically this is used to administer vaccines and some antibiotics, among others. This is also used in slow release of the drug from the injection site. Yeah, so the advantage is that it can give rapid absorption. Yes, and also the pass effect is also avoided, and it is useful for protein drugs because they will not be broken down in the GIT. The disadvantages is that it is expensive because we need equipment still like needles. It can cause irritation in the injection site, as you see when we are still doing specifically ivermectin, when you're giving it subcutaneously, yeah, it can cause irritation on that side. Then preparation of the injection site is required. Then longer durations than the intravenous. It can take a long time and your action. And only small doses can be injected. Yes. Intramuscular route, here we are injecting directly into the muscle. So here we require a longer needle. And most of the drugs are usually given via this route. But we use basically two areas, that is the neck region where we inject in the neck muscles and also the gluteal muscles. So what are some of the advantages of this is that it is suitable for rapid action, that is when we are doing with aqueous drugs. And also it is also used when we want sustained release or slow release. That's when we are giving drugs in form of suspensions. Then it can be used to give large volumes of drug doses. It can also be used when for drugs with poor oral absorption, those that cannot be easily absorbed within the GI, especially those that are lipid soluble, that take long. Then it can overcome the fast pass effect, yes, because you are not using the GIT route, and then longer durations compared to the intravenous and the subcutaneous still. This one can act for some good time. Disadvantages is that it can cause pain at the injection because we are injecting directly into the muscle. So you just understand that pain the animal can pass through or the individual. Expensive dosage forms, most of the drugs that are being used, and even the needles that are used to inject are really expensive. Then it can result into injection fibrosis, whereby the area where we have injected can swell because of maybe some improper techniques that are being used or the drug being delivered with great frequency. Yes. Then the next route, this is not under the intravenous, but it is called the intraperitoneal route. This one basically we can use infusion or injection into the peritoneum. So we are giving the drug into the peritoneum. That is the space between the pelvis, the pelvic space, and also the abdominal space. That is the peritoneum. And this is often used in the peritoneal dialysis in the renal insufficiency. Yes. So advantages is that large volumes can be given and also rapid absorption. You can add on the fast pass effect being avoided. Yeah. Then the inhalation route. This is you basically used for volatile drugs or those that are in gaseous forms, for example, the asthma drugs. And these ones are administered as nasal sprays, or we can use nebulizers or inhalers, depending. But this is an expensive one, but it has advantages in that there is rapid onset of action. Immediately they take it, the animal can really show the effects. Then also it can be used to achieve local effect on the nasal and bronchial membranes. Yeah, and then large surface area because it can reach in different parts of the body as we inhale in these drugs. Then it can lead to basically we can give direct delivery to the target organ. For example, if the target organ is the lung, this drug will go directly to the lung cells. Yeah. Topical, which is the last route. This is applied on the skin or in the mucosal membranes. So if it is applied, the forms in which we apply on the skin is where we are using drugs in form of lotions, creams, and ointments. Or if we are using the mucosal membranes where we are applying, this is where we are giving the drug in form of eye drops, ear drops, and some ointments still can be used to do that. Advantages of this topical route is that it has less adverse effects because it is the skin. Then local therapeutic effects can be achieved on the skin, eye, and ears. Yes, so it can only be applied to those areas that are injured and not affect other areas systematically. Then it can be used, the other advantage that overcomes also the fast pass effect, and it is convenient, and also has an ease of application in that the individual themselves can apply it by themselves. If they are animals, one person is enough to apply this drug depending on the hostility of the animal. Yes, thank you so much, and see you in the next presentation. Subscribe to our channel.